Hello, everyone. I'm Julie Campbell. I work at North Alabama Regional Council of Government. I just want to thank John Burns Law Office for inviting us to be a part of the Community Connection. And today I'd just like to share a little bit of information on Medicare and also the Medicare updates that's coming up for the annual open enrollment period. So let's just jump right in. So when it comes to SHIP, State Health Insurance Program, it is a free, unbiased assistance to Medicare beneficiaries for Medicare coverage. We're local, and it's just a great resource for Medicare beneficiaries to be aware of and to know that we're available. Now, when I talk about Medicare, there's two options I say of Medicare. Option one being Medicare Part A and Part B. Part A is the hospital portion. It covers inpatient hospital stay, hospice, and home health. Part B will cover doctor office visits, also medical equipment that you may need. The other option of Medicare would be a Medicare Advantage plan. So it kind of takes just some mixed up benefits and kind of puts them all together in one. Usually those plans are HMO and PPO, and you typically work in their network or by referral. So that just sums up the general Medicare information. Now, with Medicare updates for 2021, there are going to be 32 drug plans available for Medicare beneficiaries to choose from in 2021. It's just good to have that benefits checkup to see if one of those plans, by switching to one of those plans, if it will be cost efficient and coverage, better coverage for the medications that you take. The other big update for 2021, if you are, on the news and things like that, we have the senior savings model that will be available. There's 10 of those drug plans that have partnered to work alongside with that. So if you're a diabetic and you take insulin, it may be that your insulin possibly could be covered under one of those plans. And if it is, then it may be $35 or less a month to fill that medication. The other big update is with Medicare Advantage plans in regards to folks with end-stage renal disease. So if you have kidney failure and you're on dialysis, there will be some Medicare Advantage plans that can provide coverage for that. I do say when beneficiaries are thinking about changing when it comes to the health part of benefits, it can be a little overwhelming to have those commercials on TV and to get those things in the mail. But I would definitely say that you want to do your homework and check with your maybe primary care physicians or any doctors you see on a regular basis just to make sure that that plan choice that you're making is the best one for you moving forward. Now, there's also a couple of programs called the Low Income Subsidy and Medicare Savings Program that can assist beneficiaries if your income falls into a certain range. It can provide some financial assistance paying some Medicare cost. So once again, you can call to have that benefits checkup and we can screen you for some of those programs to see if you qualify. The other side of my job is through the Senior Medicare Patrol. Now, if you're not familiar with that, that's basically education and outreach to Medicare beneficiaries to help them be able to detect fraudulent activity or errors that may be taking place. So it's real important that, as you're going to the doctor or if you're in the hospital and you receive a Medicare summary notice, that you're reviewing that and you're also checking to see if there's any kind of billing issue for a service that you may or may not have received. And if you're on a Medicare Advantage plan, you'll probably receive an evidence of benefits. It's kind of the same thing. It just breaks down basically based on the services you received while at the doctor and the hospital, just the billing charges that were submitted, just to review those to make sure there's not anything there billed for a service that you did not actually receive. It's just real important to be proactive and doing that just to help save money and just help hold people accountable as well. It may just be an error on the part with the billing code. So it's just, once again, if we review those things and we see those, we can point you in the direction on how to get that corrected. Now, I guess in regards to other people that do assist us with SHIP, and we have volunteers in Coleman and Lawrence County. They are SHIP certified. They do an amazing job to also help. And just to say about the amazing job, last year alone, us working together in 2019, we saved beneficiaries just over $1 million in cost savings. So as I say again, a benefits checkup can be very beneficial to you guys if you've never had one. You may be able to save some money and put money back in your pocket that can help, pay for things like food or, when you fill your medication or things like that. I also just want to mention from the preventative side, it's good to make sure you have that yearly checkup done. And just for wellness. And talking about wellness, we do have a new Arthritis Foundation exercise program that will be starting on October the 15th and run through November the 19th. And it's 1 o'clock. At Rhodes Ferry Park, so you've got a beautiful setting. It'll just be a lot of fun for our seniors. If you're interested in that program or coming to be a part of that program, I encourage you to reach out to Stephanie King here at our office. Our office number is 256-355-4515. Also, we're located on Jackson Street here in Decatur. I just want to encourage guys that we have lots of services here at our office. We also have Access Alabama, that one door where you can make that one phone call to get the information resources that you may need. So you just may not have a phone number to a local resource that you're looking for. We're here to help however we can, to something so simple as, providing that, or, if you're needing additional services. I encourage you to check out our website and also our Facebook so you can get a more in-depth look at the services we do provide. We're just happy to serve and help in the communities that we do work in. Once again, I just want to thank Burns Law Office for inviting us to be a part of Community Connections. I look forward to hearing from some of you. If you decide that you do want a benefits checkup, please reach out to me. Once again, we always want to be available and we want to serve and help that we can provide in our communities. Thanks again and have a great day.